Over 10 months of pregnancy, give or take, the female body undergoes what is nothing short of an awesome transformation to make room for another human life. After birth, many women are eager to get reacquainted with their bodies as their own. A great place to start is with some of the muscles that have been stretched and transformed the most through the process, the abdominals. While the abdominal muscles consist of many layers, today we will focus on the deepest one. The transverse abdominis is a broad, thin muscle that spans horizontally across the abdomen and functions like a girdle supporting the abdomen and low back during movement. It is also intimately tied to our breathing, and when activated, compresses the abdomen to aid with exhalation. Evidence shows that there is not only a change in muscle fiber length, but also in the line of pull of these abdominal muscles as pregnancy progresses. This reduces torque production and functional capacity to produce movement, especially after the first trimester. It's important to restore optimal motor control and tone to these muscles to help support our body for healthy movement. And while this video was developed to target postpartum women, these exercises can be beneficial for everyone, male or female, especially those experiencing pelvic or low back pain or discomfort. So let's get started. The first exercise is really the foundation for all that follow. You nail this one and you'll be on your way. Transverse abdominis activation. You may also hear it referred to as abdominal bracing. The goal of this exercise, theoretically, is to isolate the transverse abdominis and optimize its function of cinching and supporting the abdomen. In reality, this exercise is recruiting multiple layers of abdominal muscles, but the functional goal remains the same: to re-establish the mind-body connection and activate the muscles that support the abdomen and all of its contents. First, lie on your back, bend your knees, and place both feet flat on the floor, hip-width apart. Next, establish a neutral spine. Do this by slowly rocking the pelvis forward and backward, first arching your back, and then imprinting your back onto the floor beneath you to demonstrate two opposite ends of a spectrum. Then, find a comfortable neutral position between these two extremes. This is your neutral spine and will become the base position for these exercises. Next, place your palms over your abdomen with the heel of your hands on the bony part of your hip, and your fingers fanned outward toward your midline and navel. Your hands placed here will serve as a guide, providing you feedback on how your abdominal muscles and pelvis are responding and moving during the exercise. Inhale through your nose, and as you exhale, gently draw your navel down towards your spine, keeping your back in a neutral position. Imagine the bands of your transverse abdominis muscle shrinking to the center as if they are being zipped up the middle. The tips of your fingers may actually move towards each other as you exhale. Remember, the goal of this exercise is not to suck in or hollow out your belly and flatten your back to the floor. Contract only to the point of feeling muscle tightness, not movement of the abdomen towards the floor. To encourage a stable pelvis and discourage hollowing, it may also help to visualize your tailbone reaching long underneath you in the direction of your heels and the wall in front of you. Perform this exercise by holding the contraction for 5 sets of 5-second holds. When this becomes easy, progress to 5 sets of 10-second holds and focus on maintaining the contraction through normal breathing. Before progressing this exercise, make sure you are comfortable finding and maintaining a neutral spine for a minimum of a 10-second hold while breathing normally. Once you are able to do this, you may consider adding different progressions to make the exercise more challenging. Each of these progressions begins with the prior exercise as the foundation and builds on additional challenge by adding leg or arm movement. Heel slides. While maintaining the contraction, slowly slide your heel forward on the floor to straighten your leg, and then slide your heel back into its starting position. Remember, the goal of this exercise is to maintain the transverse abdominis activation throughout the movement. So try to minimize movement of your pelvis and maintain abdominal contraction for the duration of each slide. Perform 3 sets of 10 repetitions on each side. These can be done with all 10 in a row on each side, or by alternating legs for additional stability challenge. Marching. Maintain the contraction and stabilize the pelvis while lifting one heel off the floor and placing it back down. Again, you may choose to lift one heel at a time or to alternate lifting of the feet. Try to minimize movement or shifting of the pelvis, and remember to visualize lengthening your tailbone long as you lift your legs. Heel slide with leg lift. The third progression is a combination of the first two. Perform the heel slide, only this time when your leg is extended. Lift it off the floor without bending your knee and place it back down, slow and controlled, before sliding the heel back in. It may help to exhale during the leg lift to support activation of the lower abdominals, stabilize the pelvis, and minimize arching of the low back. Finally, you can add additional challenge to any of the progressions already shown here by adding alternating arm movements to further challenge stability in your pelvis and trunk.